Hello, my name is Grace Reese. I'm a 7th semester nursing student, and today I'll be demonstrating the skill of administering a medication through an enteral tube. Before I begin, I want to make sure that if my patient is hooked up to suction, that is discontinued and it is ceased for about 20 to 30 minutes after administration of medication to allow absorption. And if he is receiving a tube feeding, I want to discontinue that as well. Mr. Jones, my name is Grace. I'm going to be your nurse today. I'm going to be giving you a medication through your NG tube, the tube in your nose, okay? I'm going to be performing hand hygiene and donning gloves. My first step is to make sure that I'm administering the right medication to the right patient, the right time, the right route. Mr. Jones, could you verify your name and date of birth for me, please? Thank you. I also want to make sure that Mr. Jones has no allergies to the medication I'm administering, and that any previous assessments that should be done have been completed. If I was administering a hypertensive medication, I would want to take Mr. Jones' blood pressure, heart rate, and respirations before administering. I have my medication here. I'm going to go ahead and prepare that. I have a pill cutter here. I'm taking my medication out and putting it in the pill crusher and crushing that. Putting it in a cup with about 20 to 30 mils of water. About 20 mils of water in there, and dissolving that. Before I administer this medication to Mr. Jones, I want to make sure this bed is at working height, that he is in a high Fowler's position, and I am going to make sure that the NG tube is still in the right place. There's a few ways I can do that. The way I'm going to be doing it today will be to aspirate some contents and check the pH. I use a pH strip. I will unclamp the tube, aspirate contents, reclamp the tube, and test the pH to make sure that it's in the stomach before I administer the med. Another advantage to this is I can be checking the residual volume. If Mr. Jones has a lot of residual volume in his stomach, it's going to mean that he's not digesting or passing things through his digestive system properly, and I should probably hold that medication. That is up to agency protocol. So we're going to say Mr. Jones has the appropriate amount of things in his stomach and that the NG tube is correctly placed. I could have also checked this placement with an x-ray, which is the gold standard, or to insert about 10 to 30 mils of air in here, listen over the epigastric region for a whooshing noise to make sure that it's in the stomach. All right. I would now like to take my prepared medication. I'm going to draw up 20 to 30 mils. I'm going to make sure that my medication is okay to be crushed and passed this way. And first, I'm going to flush his tube with 20 to 30 mils of water, clamp it, draw up my medication, unclamp, pass the medication, clamp, 20 to 30 more mils of water, flush again, and continue that process for each individual med. You do not want to mix multiple meds and pass them through an NG tube at the same time. You want to do each med individually and make sure you flush in between each med. Assuming that Mr. Jones is doing okay with this medication, my next step are to document the medication that I passed and to also make sure that I document the flushes through his NG tube as in his intake portion so that we maintain an accurate grasp on that. I'm going to ask Mr. Jones to remain sitting for about 30 minutes after also to kind of help everything settle in his stomach as well. And that's it. Thank you.